I'm Peter Block for On the Scene here in Chicago at the AHA annual meeting. With me is Joanne Manson from the Brigham and Women's, and we're talking about the VITAL trial. But before we begin, I have to say that yesterday in our wrap-up, we were talking about the VITAL trial and said, you know, omega-3s and vitamin D is, throwaway, don't even bother about it. But that's just flat out wrong. And talking to Joanne about the real outcomes of the VITAL trial, it turns out that omega-3s are still in play. So Joanne, tell me about the VITAL trial in a short version as to what you did, and then we'll talk about the findings, which are a little complicated but important.
We looked at a very large cohort, nearly 26,000 U.S. men and women, and tested whether the omega-3s, with or without vitamin D, could reduce the risk of a first cardiovascular event or cancer. So it's a primary prevention trial, and it's actually, to our knowledge, the first large-scale randomized trial of omega-3s in primary prevention in a usual risk population without prior cardiovascular disease or selected risk factors for heart disease.
Good. So let's get to the really, really short version, which is the vitamin D. Tell me what vitamin D did or did not do, and then we'll go to omega-3, which is much more complex.
Okay. So vitamin D, 2,000 IUs a day of D3, did not reduce the risk of cardiovascular events. Even when we looked at those who had relatively low blood levels of vitamin D, 25-hydroxy-D, no reduction in major cardiovascular events or the secondary endpoints. It did, however, show a signal for a reduction in cancer death. No reduction in incidence of cancer. However, there's some evidence from previous trials and laboratory studies that vitamin D may affect the tumor biology so that it makes tumors less invasive, less likely to metastasize. So this does need to be explored further, but we think it's not quite ready for prime time.
Okay, so for now, just get that point over. For now, vitamin D is sort of off the table as far as cardiovascular disease is concerned.
For cardiovascular disease, yes, no evidence of benefit, and shouldn't be megadosed either.
Okay, so let's move to omega-3, because this is the complex area, and I'm going to give this one to you. What do you think about the omega-3 outcomes? Tell me what they are, and then what should we do with it?
Overall, for the primary endpoint of major cardiovascular events, there was a small but not significant 8% reduction. However, for the pre-specified secondary endpoint of total myocardial infarction, fatal plus non-fatal, there was a statistically significant 28% reduction, but no reduction in stroke or total cardiovascular mortality. So the primary endpoint was attenuated by the non-coronary endpoints.
Okay. So one question that's always important when we talk about percent reduction, what were the actual numbers, Joanne?
The actual numbers for heart attack, there were 200 incident MIs in the placebo group and 145 in the active treatment group.
So what's the difference in percentages?
28% reduction.
Yeah.
So the hazard ratio was 0.72.
Okay, so there is a trend certainly that the omega-3s decrease this myocardial infarction visit. Cardiovascular death and overall death not affected?
Cardiovascular and overall death were neutral. However, for MI death, the hazard ratio was 0.5, but the numbers were small. There's a significant reduction.
Okay, then there's one other last issue, and that's the question of if you're eating fish or not eating fish, right? That makes a difference.
This is where there really was a very important signal that if you're already having fish consumption above the average for the cohort, which was 1.5 servings of fish per week, there was no reduction. But for those below that amount, there was a statistically significant 19% reduction in the primary endpoint of major cardiovascular events and a 40% reduction in myocardial infarction.
All right, so for the non-fish eaters or people who are allergic to shellfish or just don't like fish, probably not a bad idea to take omega-3s.
Right. If they should still be encouraged to have fish in the diet because it can replace red meat and saturated fat, processed foods, leads to a healthier diet. However, if they're not going to eat fish and they're not allergic, then it may be reasonable to consider fish oil. However, we do think that more research is needed in primary prevention. Again, this is the first large-scale usual risk population trial. And if this can be corroborated, there may be an important role for omega-3s in reducing risk of first heart attack.
I love it. So there you have it, folks. We've been talking about eating fish 3 times a week for 110 years at least, and people still don't listen to that. Omega-3s may be helpful. It's a very complex and interesting trial. There's going to be more heard about the outcomes of VITAL. Thank you so much for being here, Joanne.
Yeah, thank you so much, Peter.